I'm Imam Pliman Alameen, and I would like to welcome each and every one of you to Faith Over Fears and Facts Over Misinformation, our faith-based town hall gathering. We have great participants this evening, and we want to share a lot of information with you. And we also want to hear your feedback and get information from you, insights and information from you. I want to start, though, one of the key people in our community who's really working to rid our community of COVID-19 and keep us all informed. Dr. Tabia Akintobi is the professor of community health and preventive medicine and associate dean of community engagement at Morehouse School of Medicine. And there's no better place to start this conversation than with her, Dr. Akintobi.
Thank you so much, sir. I so appreciate all of the panelists and those who are attending this evening. We know you could have been anywhere else and you chose to join us this evening to have a safe space to discuss a difficult place that we're in. But we know that with faith and with influencers like you, we can turn the tide in how COVID has ravaged our communities. We see a way through this, and it takes all of us. So I'm very pleased to be collaborating with those who are panelists today and look forward to partnerships with many of you who are joining us to talk about the path forward. It was very much by design that we titled this conversation Facts Over Fear and Information Over Mis or Disinformation, and how faith-based influencers are central to not just understanding the problem, but addressing the path towards COVID resilience and recovery. So I would be remiss in collaborating with the moderator if I did not acknowledge and give important space for Reverend Dr. Jasper Williams to share his perspectives and his vision for this Interfaith Alliance Against COVID. He's the founding visionary and pastor of Salem Bible Church and Acts, which I'll ask him to detail. But we have been brewing together ideas surrounding an alliance that represents faith influencers and how their role, their networks, and their leverage can be elevated and amplified to address and turn the tide on COVID. So Reverend Dr. Williams, I'd love for you to share your perspectives on where this came from in your mind and a bit of what you hoped we will do together in this path forward.
Thank you, Dr. Toby. I appreciate your fine words that you uttered about me. Just let me say in the outset, I have always wanted to do something. And when I determined how difficult the COVID has been in our society, I began to think, how could I make a difference? And I know that in my own personal denomination, whatever it is not big enough, because the broader thinking that we allow ourselves to acquiesce, the better it would be. So I began to think in terms of how could we do this ecumenically? And the idea came that we have a lot of people controlled in the faith community by a few people who are at the top. And so I corralled these people who were over various denominations, like we have on board with us, Dr. Bishop Thomas Brown, who is over the CME Church throughout the state of Georgia. We have Dr. Corbett, who is the president of the General Missionary Baptist Convention of Georgia. We also have Dr. Winston, he's on with us today, who is over many churches of the Seventh-day Adventists throughout the Georgia area. Bishop Paul Morton, who is over Full Gospel. He's the founder, organizer, and builder of that denomination. The Reverend Dr. Ike Mack, who is one of our panelists as well tonight, who is the illustrious president of the Fellowship Missionary Baptist Convention. We have Dr. Michael Baldwin, who is the president of the New Era Missionary Baptist Convention. And then we have Dr. Reggie Jackson, who is over the 6th Episcopal African Methodist Episcopal Church. 500 plus churches are under him throughout the state of Georgia. And then Dr. Watley over at St. Philip's AME Church, along with myself. These people have many churches under them. And it's my dream and desire for us to pick a month coming soon before the year is out, like the month of October, no later than November, where we're asking all of our churches at the same time, each Sunday when we give our announcements, that we talk about the importance of vaccination, that we get the message out in that period of time every Sunday, push, push, push. Our church is even beginning to pay people to become vaccinated. That's the thing that we are doing as a personal thing as it relates to our church. We're giving the $100 to those who will come and be vaccinated, because all of us need to do this. So that's just to show the vision that God gave me in terms of a few people influencing a whole lot of people. And I thank you for that opportunity, but that's the vision in a nutshell.
Thank you so much, Reverend Dr. Williams. And before we turn it back to our moderator, we need to make sure that we introduce him. I know he'll share his own perspectives, but this Interfaith Alliance is not a closed one. And it certainly takes all faith influencers to be a part of this. So we were very strategic and are grateful that Imam El-Amin, he is Imam Emeritus of the Atlanta Masjid of Al-Islam, one of the largest and most progressive mosques in the US. He is the former director of the Clara Muhammad Elementary School and the W. Dean Muhammad School of Atlanta. His reach is well beyond Metro and well into the Southeast. So I wanted to acknowledge his important leadership, presence, and moderation of this discussion. It takes all of us, and we're so glad you are moderating and facilitating this important safe space. Imam.
Well, thank you very much. And thank you, Reverend Jasper Williams, as well. We're so glad to be a part of this. And one of the few things that we can take away from the benefits of this pandemic is that it allows us to see that we're all in this together, and that we must join together and cross borders and boundaries so that we can overcome this great test and plague that's on us. We're in the summer surge. We're really, though people have felt so good about getting back to normality, that they are overlooking the fact that we are back into the days of high incidence and high hospitalization and contracting this virus. As of just a few days ago, more than 100,000 people were hospitalized for COVID-19 throughout the United States. Since June to this August, the 7-day moving average of cases has risen from 12,000 to 150,000. On just 3 days ago, on August 28th, there were 11,500 new hospitalizations, and the increase was 6 times the number that it was just 2 months ago. Here in Georgia, the Delta virus represents 92% of all the cases. And just last week here in Georgia, we had 19,000 cases, and that was like a 30% increase. Hospitalizations has gone up 22%. Deaths are up 37%. These are serious times, serious days that we're living in. And we sort of knew that in the beginning last year, but now we've lost sight of that, I fear. Across a period of just the last 2 days, 184 African-American Georgians were hospitalized due to the coronavirus. And the spread of the Delta virus is much more serious because it is mutated and it's 50% more contagious than the original strain of COVID-19. A person infected with the Delta carries approximately 1,000 more copies of the virus in their respiratory tract than those infected with the original strain. So what that means is that whereas it took approximately 15 minutes of exposure with the original strain, with this Delta virus, unvaccinated people can get infected within seconds of coming in contact with someone who has it. This is very, very serious. And though there are some breakthrough cases, I know some people say, well, some people who got vaccinated, they still got it. There are some breakthrough cases, but those breakthrough cases are less than 1% of the people who are vaccinated, and less than 0.02% of those people die from contracting. So this is serious concerns that we have, and we're so glad that the faith community is engaged in bringing this forth. We're going to discuss tonight the urgency of the COVID-19 in our communities, the brown and black communities, and all communities really, but the benefits of vaccination and how the vaccination gap is a barrier to recovery and stopping the spread of this virus, and how faith leaders and institutions can help to overcome those barriers and to create a COVID-free society and communities. We have a wonderful, wonderful panel. We've already mentioned Dr. Akintobi, and she will start us off, but let me make mention of the other three panelists with her. Dr. Teresa Jacobs is the medical director for the Georgia Family Planning Systems and the Georgia Association for Primary Health Care. Dr. Ike E. Mack is the pastor, as he's been mentioned already, but the pastor of the Unionville Baptist Church and the president of the Fellowship Missionary Baptist Convention of Georgia. And Elder William Winston is the president of the South Atlanta Conference of Seventh-day Adventists. So you see, we have a great mix of people and experts, and we're going to engage you as well to hear your ideas, your thoughts, and to try to answer any questions that you may have. So let us go back to Dr. Akintobi. Doctor, it seems that we are in a state of crisis, almost where we were, but yet we don't have that sense of urgency and that frame of mind to keep our masks on, to keep distance, and even the idea we have so many people that refuse to get vaccinated. So why don't you start us off to help us understand more clearly what's happening and how we got here and where we need to go.
Thank you so much for that. So, you know, we always must start with what got us here. And there was a lot going on ahead of COVID that have been the realities of not just policy, social, but health systems and economic systems that have particularly placed communities of color in a position to be disproportionately affected by any public health or health onslaught, right? So when we think about the realities of more of us being uninsured, the history of both Black and Brown and other disenfranchised communities having less access to economic growth and development, those things equal less opportunities to quality health care, meaning that when things like diabetes and cardiovascular issues occur, they are more likely to be diagnosed late, if at all. And I explicitly describe diabetes and cardiovascular health issues because those are some of the comorbidities or things that work together when people get COVID to increase their likelihood of hospitalization, of illness, and death. So let us remember that COVID is not our first rodeo in terms of the realities of poorer health outcomes. It is just that when there is a public health crisis, everything that was wrong becomes exacerbated and magnified. So let us be clear that COVID is just the health issue of the day. And so it takes all of us to make sure that we acknowledge the importance of prevention and also, based on where we are now, educate people not just about COVID and vaccinations, which we'll talk about throughout our discussion, but remind people what their rights are in terms of what is required and what's not required to go get vaccinated or to get tested, that your employer cannot fire you if you choose to get vaccinated, or if you are COVID positive and need to be home and quarantine. We as a people have been inequitably left out of the conversation. And so for those reasons, it takes all of us to ensure that communities co-create the solutions and the resilience related to COVID. So you'll hear a lot from different perspectives about the importance of influencers and the right messengers. We are very clear that in times of crisis and in times when things are peaceful, that faith-based leaders are those that communities look to get answers, to get solace, to commune, to fellowship. And so it is by design that this town hall has focused on both those who are part of faith-based communities and also are influencers in the faith-based community towards turning the tide. So I'm going to share just a few slides to anchor our discussion and to begin with the end in mind. So Georgia CEAL is a community engaged alliance against COVID. There is one in now 21 states. For those of you who are joining us from other states, hopefully you will find a CEAL in your state. Most CEAL states have been COVID hot, and these are states that are hot for all of the wrong reasons. Hot is not a good thing in this case. And so Georgia is about the belt for everything negative, whether it's diabetes, stroke, HIV, etc. So it was a great opportunity to bring together leaders like those who are on our panel and who are listening to talk about what we are already doing, how we can amplify it and work together to address COVID. So quickly, CEAL, and CEAL is you, whether you're in Georgia or beyond. CEAL is designed to conduct urgent community engaged research and to provide information to address not just misinformation and mistrust. And what we're learning as the language evolves is misinformation is information which is shared and disseminated and is not quite fact, but is not done with any malintent. But we know that disinformation is information that is shared with an intention to dissuade people from doing those things that might potentially help to decrease their risk. And so we want to promote and facilitate inclusion of diverse populations, not just in vaccines, but also in vaccine trials, because we know ahead of COVID, we were not racing to participate in vaccinations and COVID and vaccine trials. And we must have leaders who look like those that they serve to really promote and make sure that our voices and representation is there. I wanted to say in my few closing comments for now, though, is that wherever you are in your thoughts about the vaccine, this is a space, a safe space for you. We know based on the statistics that those who are vaccinated are less likely to be hospitalized, to get sick and die. But what we know is that nobody wants to be sick. And so we want to be sure that we are promoting and going back to basics to remind all of us that wearing that mask, even though we're tired and ready to bust loose, is something we cannot stop doing. We must still physically distance as we choose to commune together. We must wash our hands. These are all the basics that we know, irrespective of your vaccine status, will keep you and those you care about safe. So I will stop by saying that Georgia CEAL has resources and information that Brittany will share later that you can use as you think about making sure you say the right thing when someone asks you, okay, what is going on with the variants? What is going on with these breakthrough infections, et cetera? We are here to be a resource for you. You see the number there. We'll put it in the chat. We're here to have community credible influencers share factual information that increases people's confidence, not just in the vaccine, but in ways that they can promote their own health and the health of their communities. That is the way that we will make sure that facts are really ahead of fear and our communities are safer. So I will stop there, Imam Elamin, and look forward to questions as folks tee them up.
Yeah, very good, very good. Powerful, Doc, powerful. And serving, she's a resource right here in our community. I do want to mention that if you have questions as you start listening to people, if you have questions that you would like to post or even answers that you might want to post, there's a Q&A tab at the bottom of your screen. You can do so. But listen carefully, and if you have a particular question for a particular panel member, then mention that person's name and we'll make sure that question is answered. Now we want to hear from Reverend Dr. Mack. Why did you get involved in this particular effort? And what are you seeing and hearing on the ground in your community that gives you cause for concern? And what do you think the hesitancy is in the community about these vaccines? It's a lot, but go on and start wherever you choose. You're on mute. Take your mute off. Yeah, there
Hi,
you
Mr.
go.
Moderator. Thank you so very much. I'll be honest, when COVID first came to our attention, I knew that it would be a serious crisis, but I decided within myself that I would just be a little selfish, take care of myself and my family, and not be a persuader to my congregation or to anyone because of the sensitivity of this matter. But I was asked to attend a webinar that was hosted by CNBC, which is a Conference of National Black Churches, on April 25th. The webinar was entitled, "The Black Church Mobilizing African American Communities to Overcome Vaccine Hesitancy." It had three notable presenters. One was Reverend Al Sharpton, the other was Dr. Anthony Fauci, and the other was Dr. Kamara Jones. And after listening to the opening statement by Reverend Sharpton, I was convicted. Reverend Sharpton opened up by saying every prophet preacher is called to address the infirmities and challenges of this time. Instantly, my mind started to look back at Ezekiel as he was challenged to preach to a no-spirited, no unified group. I thought about Moses that preached to a group that was enslaved as well as impoverished in sin. Also about Paul, who preached to educate and to strengthen weak leadership. So I felt that Ike Mack, Jasper Williams, and many others should be empowered during this challenging time to address racism and the debilitating disease under the heading of COVID-19. I feel clear that I heard a call, and the call came from two J's. One was Jesus Christ, and the other one was Jasper Williams. And I believe that this journey has been quite a task, but God gives us the strength to do that. There's much misinformation that we hear every day. People tend to self-educate themselves, which is not totally bad, but if you don't have the right textbook, then that means your information cannot be factual. And from that, it spreads like wildfire. So the misinformation that has brought about mistrust has landed us in a very precarious place. Needless to say that similarly the government from the top shelf started off dragging their feet and not being actually zoning in on the criticalness of this. So I think when you couple all that together, mistrust, misinformation, the government not stepping up to the plate and making this thing more real and of urgent, has gotten us in the dilemma that we're in. But organizations like Georgia CEAL, interfaith groups are really here to say that there's still light at the end of this dark tunnel. There is still a helping hand if you will only reach up and take the hand that's extended to you.
Yes, sir. Thank you. Thank you. And now, Elder Winston, the same questions. What are you seeing on the ground? What got you involved in this particular effort? And what might you be doing, or any of us, what can we do to address this hesitancy we see in our community?
Thank you very much, and thank you for having me as a part of this panel discussion tonight. To answer the last question first, I could answer that with one word: funerals. I am so sick of funerals and standing around a grave site with 8 or 10 people and restricting who can be there. And it didn't have to happen. It did not have to happen, but because of polarization and misinformation, so many people have died needlessly because of that. I'm old enough to remember when we didn't have to wear seatbelts in a car. And when you said you got to wear seatbelts, people just went up in arms. They just went crazy. No. I'm not going to wear a seatbelt or a motorcycle helmet. Or they're going to put fluoride in the drinking water, or you can't smoke around me. Secondhand smoke will kill you. People resisted all of those things, secondhand smoke. And now it is a matter of, these are my rights. I have a right to kill myself and kill you too. In the idea of the church, when I signed on to this gospel ministry, I signed on to help extend the healing ministry of Christ, whether that was physical or spiritual or social or whatever it was. The Black church has been the anchor in the Black community since as far back as you want to go. Got us through slavery, got us through so many crises, and we are social people. Black people are social people, and the fact that we can't even get together in church, and that when you see somebody, you got to give them a fist bump or elbow. We are huggers, and we are touchers, and we're all kinds of social creatures. And this idea that this COVID vaccine can stop us from being who we are just because of who we are. So I am very sensitive to what we need here in the Black community. The misinformation that is out there, let me call it what it is, the lies that circulate out there about this vaccine has just done a job on us. And if we sit by idly in the church or in the community and say nothing and let this misinformation happen. So when I was asked to be a part of it, I was excited about it. This is smallpox all over again. This is measles. This is diphtheria. This is all. And we overcame that. Those of you who are in the medical community, you're the reason that we are alive still, because all of those things could have taken us out. But right now, we have to fight against the misinformation that is being circulated among our people and get the word out there from the healthcare professionals and from the science that has already proven that. I can't wait to get my booster. I'm still a month and a half out. I just can't wait. And if they have 2 more boosters or 3 more boosters, I'm gonna get boosted every time. I believe in the science. I believe in what's out there. And I think we need to tell people how we see it and what we believe for their own best good. So thank you.
Yes, sir. Thank you very much. You know, one of the other challenges we have is that a lot of people see religion and science being opposed to each other. And so this is one of the challenges that we're trying to overcome with this group, with the Faith Alliance being involved, is to let people know that really all science, all true science comes from God. You know, it comes from God. We find it in the creation. We find this order and these principles that have been placed in our environment, in our creation, and we just discover them. We're not inventing these things. We're just discovering. And for every disease, I believe, for every disease, God has given a cure.
Yes.
But we have to take the cure. we have to take it. So now, Dr. Jacobs, you please share with us through your expertise the latest myths and the facts that clarify those myths.
Thank you for having me. It's always a pleasure to talk to our folks. What science says myth and what's fact, or as someone said, what's a lie. Frequently that these vaccines causes infertility. They absolutely do not. You hear frequently that it will control my DNA, and that there are towers that are put up throughout the world that through this vaccine and my DNA, that the government is going to be able to control me. We're not that good, guys. We're just not that good. I tell people this all, we're not that good. And so no, we're not able to control you. These vaccines do not alter your DNA. As a matter of fact, this particular virus doesn't use DNA. It is an RNA virus. So that's a little bit different, a different kind of genetic material. And so it does not alter our DNA. It does not get in our bodies and do strange things to our bodies. I also hear that it's not safe in pregnancy. Well, there have been multiple studies around the world where they've proven that if a pregnant woman gets that vaccine, she passes immunity to her unborn child. Isn't that a wonderful thing? That means that this baby that's going to be born is going to have antibodies against COVID. They also discovered that if she breastfeeds, if a vaccinated woman breastfeed, that there's antibodies that go through the breast milk to the baby, again conferring what they call passive immunity to the child. So it's a win-win situation all the way around. The other more a myth that's in the news these days is a number of folks are taking ivermectin, which is a medication that we use to treat parasites. And somebody on social media and in some of these other radio stations and newscasters have told folks that this parasitic medication will stop you from getting COVID, or if you get COVID, that it will cure COVID. Now, there are no studies that will validate that. As a matter of fact, they're looking at the fact that if you take ivermectin off label, there are a number of folks that are showing up in the hospitals with nausea, vomiting, diarrhea. Some have had seizures as a result of it, loss of consciousness. There are also a number of deaths that have occurred because people have taken ivermectin. They've gotten it from veterinarians. It's a medication that we do use in medicine to treat parasites. The cream form we use to treat skin rashes, but the veterinarians treat cattle and their parasites. The formulation that the veterinarians use, the dosage is a lot larger than what we use in human beings. So ivermectin is something none of us should be using trying to cure or to prevent COVID from happening. So those are just a few of those myths. It doesn't magnetize you. That's not what it does. It does not give you Bell's palsy. We've proven that, not worldwide. All these studies have proven that these vaccines are safe and that it actually helps you from getting what we call moderate to severe COVID disease, unless there's an issue with your immune system. And if you're immunocompromised, then those are the folks that they're suggesting to get the boosters now. And then the rest of us that are 65 and over, or those of us that have comorbid conditions like high blood pressure and diabetes, they're suggesting that starting September 20th, we get our boosters, and then everybody else will come behind them. And that's because that have comorbid conditions, your immune system starts to wane, unfortunately. And so you're going to need a booster to kind of help you to get through this cold, flu, and COVID season that we're riding into, because it appears as if it's going to be pretty rough. So we need to protect those folks at this particular time. And I'll stop there.
And as it was said, this is a safe place. So we do want to hear those who have some hesitancy. We want to hear what concerns you, what problems you're seeing, why you have not gotten the vaccine, or why you don't want to get it. We want to hear from you. This is a safe place. So feel free to put your comments in our Q&A as well. That's at the bottom of the screen. I don't see Ms. Gail. Is Gail Brooks with us?
Unfortunately, Gail was under the weather today.
Okay, so Brittany
she's not able to see.
Okay, so where do we? I know we want to hear from the Black Cross aspect. So, Dr. Akintobi, are you going to deal with that? So we're going to shift back over to you, and then after that, we'll go to you, Brittany, to sort of give an overview of the resources.
Great, thank you so much. And you all, we want to see your questions, your comments related to the conversation. If there are questions you genuinely have, we want to respond to them. And I see one has come through. Ornika, do you want to read it, or do you want me to? People's wheels are turning now.
Sure. So this question is from Dr. Willie Johnson. He wants to know how they can reach the younger generation, 18 to 25, because most say that it won't affect them.
Yes. We probably have a few of us who can take some of that. Dr. Jacobs, you look like you're ready to start, and then I'll share some of the work we're doing, and others may have some ways y'all are getting through.
Yeah, I'll start. Right now we're seeing 18, 19, 20 something ICUs with double pneumonia from COVID. So can they be affected? Absolutely. We also have, there are some 2-year-olds, some 3-year-olds, 4-year-olds that are hospitalized. Unfortunately, we've had hundreds of children that have been admitted into the hospital, guys, that didn't have to be admitted to the hospital, that didn't have to get COVID. Our young people, we have to explain to them they're the most mobile in our population. And so these are the carriers of the disease to other folks. And so I would suggest strongly that we get the nanas and the grandmothers and the grandfathers to start talking to these young folks and tell their grandchildren that they need to be vaccinated because and when I talked to a group of hip hop folks the other day, and many of them told me they didn't want to put this into their body because they didn't know what was in it. That was the number one reason. So I'm going to be very honest with you. I told them, but you smoke weed every single day,
Hey.
and you get it from John up the street. You have no idea what they fertilize it with. You have no idea how they grow it. You don't know what they put in it, but because there have been no studies or trials on John's weed up the street, but you smoke it every day. Yeah, we got another group of you that you do vitamin, herbs, and supplements. None of those are FDA approved, but you take them every single day.
Yeah. Yeah.
You eat hot dogs, you eat processed meats. All that stuff is FDA approved, but you have no idea what's in that stuff. Consuming. And so don't come to me with you, it's not FDA approved when Pfizer has been FDA approved, and we have millions, hundreds of millions of folks that have taken these vaccines, and they've proven to be extremely safe and effective in preventing folks from being hospitalized. So that's where I leave it with those that young crowd, that 18 to 25. I'll let somebody else take it from there.
Dr. Jacobs, you're preaching right now.
I know that's right.
I'll circle back, but others, please.
I would just add to that we need to do a job on our college and university campuses.
Yes.
We really need to get that message to them. These are our future leaders. These are brilliant young people, and to have their lives snuffed out by something that's avoidable. I appreciate what you all are doing at Morehouse, and we need to do that in all the HBCUs and other schools around the country to let them know that this is not going to hurt you. This is going to help you throughout life and extend your life and help to make you a contributing member of society. We need those young people. We really do. And we need to preach this on our campuses.
So speaking of campuses, Malaysia, Allen has a point that she's bringing up about the unethical studies and Tuskegee experiment, for instance, and she wants to know what advice would you give her, African-American college student, to continue to help encourage our people to be vaccinated. I try educating friends and families on what vaccines are and how they help, but some always choose to say that vaccines are not of God and that the American healthcare system is only trying to kill us. So she wants to know where can we put in. And I'll add to that for most African Americans, I don't believe the tipping point would be the FDA approval. I don't think we're looking at what's FDA approved or anything, but I do follow that point, Dr. Jacobs said, that we don't have any idea on what some of the things we're taking, especially like the reefer or whatever, but it's a whole lot of things. We have no idea what's in them. What's in a hot dog? We have no idea what's in a hot dog. But who wants to answer Malaysia's question?
I'll start, and I think probably several of us have different spins on the response to this. We must acknowledge the past, and that is whether it's Tuskegee, whether it is Henrietta Lacks, whether it is the Nuremberg trials for our Jewish brothers and sisters, or any other atrocity under the umbrella of research or medicine that really was designed for those with power take advantage of, mutilate, and exterminate those with less power, we must acknowledge the past. So her points, I think, are well made, and the distrust is justified, right? So, even the terms that we're using, hesitancy, as though it is the person who is hesitant who is the problem. It is our system, our history, and our system of those who are less powerful being mutilated and exterminated. We must acknowledge that. However, because of those things, there are systems that are in place to ensure that no doctor or researcher can do that again. Whether they are institutional review boards that keep me and folks at Morehouse and any other researcher in check to ensure that we first seek to do no harm and to protect and have more benefit than good in our research. Those are some of the things that have been put in place to ensure, Malaysia, that those things don't happen again. And then there are wonderful current examples of researchers and clinicians of color, like Dr. Corbett, who was among the infectious disease folks who helped to develop the vaccines. More of us are in seats, not just based on loving science, but wanting to represent the communities that we came from to ensure that these things do not happen again. These are some of the reasons why we want to arm people to acknowledge the past, but know that many of us are in the house standing in the gap to make sure that the science is not just for us, but by us. And lots of information and resources that we can also share. I want to come back to the young people, but I'm sure there's other folks who'd love to address that question.
Anybody else want to jump in on the young people?
Yeah, I'll just add too, when I talk to them, I let them know that I agree with you, Dr. Akintobi, that there are safeguards in place now, and that these studies, the clinical trials, they also include us now. We are represented in all of these clinical trials. So were there people like us, were there Black and brown people in the clinical trials all over the world? Absolutely. We were a part of all of these clinical trials just so that we can make sure that these vaccines are safe in all ethnic groups and in all races. So were we included? We were absolutely included. And then they were peer reviewed, meaning that all over the world, that there were people doing the exact same thing to see if they could come out with the exact same results or something quite similar in other countries. And they were not funded by pharmaceutical companies. They were not funded by physicians. And so I like to explain to folks or to these young people that there are safeguards in place so we'll never have another Tuskegee incident, or at which I'm really thankful and grateful. And again, I heard all of these wonderful men say that science comes from God. It simply does.
And so while we're there, to any of our pastors and preachers, how do we bridge that gap of between faith and science? How do we get people, faith people, to have an appreciation for science, a greater appreciation for science? And Dr. Williams, you're Jasper Williams, so you can join in at any point you want to join in, sir.
Yeah, well, I think that we're on the road to that. And if we as the heads in terms of being pastors will really just reach out to our people, that we can solve that. Just keep pressing it. It's a continual thing that we're going to have to do just ongoingly. Just press. Science picks up, God started it. Science picks up. We all are in it together. Everything that I've heard this evening has been spot on. And I'm so proud of you, the way you have monitored and moderated us today. It's mind-boggling to me to see how ecumenical we are all being today. So we are starting it now. This is the start. And I want to be at the finish line when we get everybody vaccinated. That's what I'm looking forward to. Thank you.
Thank you, sir.
Yeah.
Mr. Moderator,
Yes, sir. Dr. Mack.
also, as we talk about trying to engage and empower our younger people, we will have to think out of the box because their way of thinking is contrary to maybe some of our ways of thinking. We're going to have to get a voice that they recognize, get a voice that they respect within their own realm, that will stand on the front line as we're standing today. I believe that we're touching not just the classes today, but I believe that we're touching the masses. And that's what needs to happen when we look at the numbers that we're dealing with and how the increase of the virus is moving. It's going to have to be some strong voices that can reach. And there are many voices out here now that our youth and younger people and young adults really respect. We could garner some of them to partner with us as we've bridged the gap with our different faith and beliefs, forgetting about our denomination, but looking more at the situation. If we could get that to happen, that would be a good place to start. They need to hear somebody of their own liking speak to them the truth about what we are dealing with and what is dealing with us.
The Bible is full of health principles, and we are encouraged to teach them to our children and our children's children. I think just sitting down with our children and our grandchildren, our children understand a whole lot more than I did when I was their age, and our grandchildren. And if we just sit down and have conversations with them, they are beautiful, intelligent people, and we can learn some things, and we might be able to share some things with them. Thank you.
All right, Doc, you have it now.
I just wanted to tell everyone to stay tuned because in the month of October, we will be having a conversation that will be featuring young adults, both college-based and community-bound young adults 18 to 25, to address just exactly what you've said. We know that the numbers of those vaccinated are lower among them, and their voices, Dr. Mack and Reverend Winston, are those that need to be elevated, not by us, but we want them to tell their stories of why they made the decision to get vaccinated or not. And we've called it Georgia Peach, Peers Against COVID and for Health. So we're looking to learn from them on who influences them and how we can actually amplify their voices for these conversations. So stay tuned for that. I'm sure as registrants, you all will get more information. And the Black Cross, which has been amazing in putting this together, is going to help us to bring it together. Reverend Winston, we have schools like Albany State, Dalton State, Fort Valley, Georgia State, which many don't know is a minority serving institution, not an HBCU, but a minority serving institution. So all of their leverage and leadership, especially their young adults, is who we're looking at. And Malaysia, we see you out there at Georgia State. We're looking for your voice as well.
Excellent, excellent. So, Brittany, we'd like to give Ms. Brittany Taylor an opportunity to give us an overview of the resources that are really available. So please do that.
Sure. Good afternoon, everyone, and thank you for joining us this evening. And just want to do a quick follow-up to the point Dr. Akintobi made. I noticed Dr. Samples is on our webinar, and she is one of the professors and doctors that will be you will be seeing during our October webinar where we're reaching the young adult population. I want to thank her for that veterinarian information she shared about avoiding that medicine Dr. Jacobs referenced. So thank you, Dr. Samples. Okay, so I am going to share some resources for everyone to use. want you to keep in mind to use these resources as you communicate the importance of getting the COVID-19 as we try to dispel the disinformation. We are all also trying to boost COVID-19 confidence and build trust. So keep that in mind when you're using these resources. And then we ultimately want to improve vaccine uptake while also asking everyone to continue to get tested. So here are some resources out of Morehouse School of Medicine. We have a vaccine clinic, and we have collectively contributed to administering over 46,000 vaccinations among community residents and healthcare professionals. We partnered with the Mexican consulate in Atlanta to reach out to the Hispanic population to do that. We are also partnering with the DeKalb County Board of Health with their mobile vaccine units. Here is a listing of some of the sites that they have visited. And the number is ever growing, but as of now, the count of doses that they have administered is over 1,500. And they just hosted a back to school and vaccination event this past weekend where they gave out $100 gift cards to those interested in getting the vaccine. And there were over 2,000 people that showed up and participated. So that's exciting. And then here are some of the resources that we share with the community and that are available to you should you like them. We like to empower you with the knowledge on the variants, answering questions about COVID-19 vaccines. These come from the NIH CEAL, which is the overarching governing body for Georgia CEAL and who is funding this initiative. We're also sharing resources from CORE, which is a community organized relief effort, and they are throughout the United States and happen to have headquarters here in Atlanta. And also from the We Can Do This campaign with HHS. We also have partners from Emory's Interfaith Health Program who have created ways and guides in ecumenical consultation and protocols for worship, fellowship, and sacraments. And then we're partnering with an electrophysiology organization in Middle Georgia called Georgia Arrhythmia Consultants and Research Institute. And they are hosting sessions on how to reopen and resume services safely so you can reopen and hold service in your communities. And we're excited to connect you with them if you would like their information as well. So here is just a brief overview of what you will see if you access the NIH CEAL, which is the Community Engagement Alliance. If you click on that Explore Our Resources link, it'll take you to resources on vaccines, diversity and inclusion, any questions you have about clinical trials and COVID-19 basics. And then here to the side is just a snapshot of what you might see with information in English, Spanish, and many other languages, as well as fact sheets, toolkits, and other websites. The We Can Do This campaign has been doing a lot of work to improve COVID-19 vaccine uptake and dispel that misinformation. It is a public education campaign. So if you go to this website, you click on campaign resources and toolkits, it'll show you a drop-down menu. And you can search by the population you are interested in finding resources for. And I just wanted to outline some of the faith-based resources that are available. And then to Dr. Jacobs' point previously, vaccines are perfectly safe for those that are pregnant. We also have a campaign that is called Greater Than COVID. Our president is a part of this campaign, the Morehouse School of Medicine president. So they are pushing public information initiative to empower everyone that we can get this done together if we partner up. And if you visit their website, there's a lot of videos and resources that you can share. Another site is Beat the Virus. And they're a good site to share if you just want a quick update on the numbers that are going on in the US and locally, they have this running banner at the bottom in yellow that just completely keeps running, and it will update you on the status of everything COVID-19 wise. And then we have the Faiths for Vaccines. It's an interfaith, multi-faith movement that can be very helpful for everyone on this webinar. So they're interested in coming together to make equitable vaccine distribution and working from a faith-based perspective. And what are we doing here in Georgia CEAL? Around the Atlanta area, you may be driving around and see one of our billboards asking you to share the reasons why you got the COVID-19 vaccine. You will soon see them popping up on your phones as ads to encourage those that are not vaccinated to get it. And we also do provide these in Spanish, and they are on the bus shelters on the sides of the bus stops, as well as we're going to have some buses wrapped in this information. So really trying to get the word out that you can do this and share your why so we can get other people vaccinated and protect our communities. And we also have flyers. We have some just handouts with really important information on the 3 approved vaccines as of now. We also provide our information in Spanish. And then we are partnering with Emory University and Georgia Tech to create a COVID-19 health equity dashboard. When you visit this dashboard, you can scroll down and view the things that you think are most helpful for you in the community you are working in and serving in. And also social media feeds, so you can see what important people are saying about COVID-19 and the encouragement they are using. And then we also have our Georgia CEAL resource kit down here in the bottom. And in these kits, we provide gloves to protect you. We provide masks to also protect you. And then we also have hand sanitizer and some pens. We distribute these out at our various events that we attend, and also to the vaccination events. And last but not least, this is just a reminder of how you can get in contact with us for more information at Georgia CEAL. And I will drop the vaccine finder link in the chat. And that concludes my presentation. Thank you.
Okay, excellent, excellent, Brittany. Thank you very much. So we want to get some last comments from each of our panel members. I think let's start with Elder Winston. And we said short, but we have a little time, so you don't have to make it. You don't have to stay with 20 seconds. So take your time. So we'll go with Elder Winston, and then Dr. Teresa Jacobs, then Dr. Mack, and then we'll end with Dr. Akintobi.
Thank you. Thank you again. I am privileged to have throughout our denomination and conference many healthcare professionals. And first of all, I want to thank them, those who are here who are healthcare professionals. I was just on a call prior to this one, and many facilities that I am aware of are having trouble getting nurses. They did for a while. The bonuses attracted them, the sign-on bonuses, and then the what they paid. But the institution that I was on just prior to this is having a severe shortage of getting nurses. And it's my understanding that our institutions across the nation graduate about 150,000 every year, and they need 200,000. So they're always working from a deficit, and somebody can fact check me on it, but that's what I heard on the other call. But for those who are out here every day on the front lines battling this disease, and who are putting their lives at risk, and who do not have a chance to even be with their families as much, I just want to say a shout out of thanks to them. It is amazing the sacrifices they make, and the I started to say danger, and I guess I will say danger, the danger that they are in sometimes to do that to help us. And I get a lot of my news on the phone because I'm kind of a moving target. And I have noticed, as you have, some of the chief proponents against vaccines who have a microphone in front of them and on the airways. 3 of them have died in the last couple of 3 weeks. The chief ones who are out there with the hoaxes, they have died from this vaccine. It is real. It is real. It is real. And for those who are out here on the front lines, and I have some healthcare professionals with my grandchildren and my wife, and I appreciate the sacrifices that they meet. And if we join hands together, the clergy community, the education community, the healthcare, and all of those who are out here fighting, we'll make an impact. We will. Thank you.
Thank you. Dr. Jenkins.
Wow, Reverend Winston, thank you. I'm telling you now, the healthcare community, we appreciate what you just said, because I have colleagues that are tired. They're working 7 days a week, 10, 12, 14 hours a day. They're not seeing their families. They're not being able to spend time with their children and with their loved ones. And so we don't have to go this route. We certainly do not 2022 doing the same thing we've done in 2020, 2021. 2022 is up to us. It really is. And COVID, the reason we have this Delta variant is because we don't have enough folks that have gotten vaccinated. We don't have enough people that are wearing their mask routinely. And so COVID is doing what a virus does. It loves unvaccinated bodies. That way it replicates and is able to change itself to make itself more stronger and more virulent, meaning that it can make itself more infectious, easier to get. But it does that expertly, supremely well with an unvaccinated body. So the only way we can stop this virus is that we have to get more of us. 70% is what they call herd immunity. We need everyone that possibly can to get vaccinated as quickly as you can, so that we protect our 2-year-olds, our 4-year-olds, so that we can protect these patients. My sister's 52 years old. She has stage 4 cancer. We have surrounded her with people that have been vaccinated. And so I'm not going to talk much longer, but I always ask this question: who is it that you love enough that you're willing not to think about yourself, but to think about them? Don't you want them here in 2022? Wouldn't it be a horrible thing if you accidentally brought the this virus to them and they died because you didn't mask up or because you didn't get vaccinated? So who do you love enough to want here in 2022? I love my sister enough to, I want her to see Christmas of this year. I want her to see her 53rd birthday. I want her to see her oldest son graduate from college, which he's getting ready to do in the fall. I love her enough. My brother loves her enough. All of us around her love her enough to where we put our own feelings aside and say, we want her to stay here. So we all have gotten vaccinated. And that's the word I'm asking you. I'm going to leave you with that. Who is it that you love enough to want to keep here by just getting a vaccine? I'll stop.
Excellent, excellent, excellent. Dr. Mack. Yeah, you're on mute.
Thank you, Mr. Moderator. Again, you're doing an excellent job, as has been forestated. It is of evidence from this virus that it is still very dangerous and deadly. The CDC released a report as of August 29th. There are 638,711 people that have died since COVID-19. That's a lot of people. And yet, It is the role of the faith community to hear the call of Jesus. Jesus said to the church that we have two usage. One, we're to be the salt of the earth, and the other one, the light of the world. Salt gives flavor, and light helps us better see who, where, and who we are and where we're going. The faith community must unify itself and continue to be the light and the salt that is needed during this global pandemic. I believe that we should focus on not counting the days, but making the days count. Thank you.
Thank you. Thank you. Dr. Akintobi, before you go, Reverend Jasper Williams, give us a word about how we can distinguish faith from fear. Talk to us a little bit about faith over fear.
Well, just let me put a closing on that faith and fear by saying this, and I'm finished. Fear of the unknown is the disease, but faith in the known God is the vaccine. I'll close with just that.
I knew you would come right through, plain and clear. Thank you, sir.
Thank you.
Yeah.
I think it's all been said. I don't know what else I could add to it, but I'll just share just a few quick perspectives, and that is, as a child and as an adult, as adults, we've been vaccinated for mumps, measles, rubella, polio, chickenpox, and quite a few other things. Reverend Winston alluded to a few of them. My parents and we trust the science and never had to suffer through or transmit any of those diseases. Trust, in essence, is faith. We have seen the suffering and the onslaught related to the pandemic. Let's stop it. So I'm vaccinated, not to please the government, but to not die from COVID. I want to ensure that my family and those that I care about do not clutter hospital beds, to hug my loved ones, to live my life, for COVID-19 to be a memory, and to protect our community so we can fulfill our purpose. We see what vaccines can do. Let us have faith and trust in the science, and by faith, look forward. Imam Elamine, I'll have you have the last word. You may have some perspectives on your why.
Well, thank you very much, and thank all of these panelists and participants. It's been inspiring and enlightening, informing. Three competitions when we talk about interfaith. There are three competitions that are presented in the Quran that I think really speak to this and speak to this type of alliance. Says that we should compete in forgiveness. Competing in forgiveness. If we could compete in forgiveness, we would cut out these wars throughout the world. It says compete in patience. You know, we have to be patient. We just can't get back to normal yet. In fact, we need to think about, was normality really the normality we used to have? Can we improve upon that? Maybe we shouldn't be rushing back to the normality, but we have to be patient. And then the last one is compete in goodness. The verse that comes in the Quran says, to each person and each people is a goal to which God turns you. So strive together as if in a race towards all that is good. And wheresoever you are, God will bring you together. So this is what we are trying to race towards, this goodness of the cure, of ending this virus. And I want to close us with a few words from a universal prayer that we use in interfaith, given in the World Day of Prayer, from the prayer of Assisi.
This vaccine got developed too quickly, and that's why it's unsafe. Can somebody address that we we
Good
fast
point,
track
good
this
point.
thing.
Yes.
Dr. Jacobs, please
Yes.
take it.
Yeah, you know what? A friend of mine is a physician, and he uses this analogy that when he went to build his house, he said if he's got some contractors from California that came to help, contractors from Michigan that came to help, contractors from Texas that came to help, and contractors from Florida that came to help. He said they worked on that house 7 days a week, 24 hours a day. So instead of 6 months, when that house would have been ready, it was ready in less than 30 days. The house, because they worked on it around the clock. And that's exactly what happened with this COVID vaccine. When you got millions of dollars that were actually sent in to do this, and for the first time in the history of vaccine, we had hundreds of thousands of folks that lined up, that volunteered to be in those clinical trials. So we started out with 150,000 folks with J&J, Moderna, and Pfizer that volunteered to be in those clinical trials. And so when you have all those resources that come together like that, then we were able, those folks worked around the clock, 7 days a week, 24 hours, and we were able to get a vaccine that actually went through all 3 trials. They went through all 3 of the research phases, first, second, and third. They didn't cut corners at all. And when you heard the terminology fast track, they talked, that was actually meant about the distribution of it and the production of it, because ordinarily it would take us several additional months after the end of that 3rd phase. But since you had all those hands helping, you had all the money that was there infused in to help us get this vaccine done and to produce it and to distribute it. That's what warp speed actually was meant for. Not that it cut corners when it came to the phases, because it went through every phase that all vaccines go through. Now, I'll also say this, when Ebola came, old vaccines, we used to take us 10 or 15 years to do vaccines. Ebola came along, it took us that, but we got down to 5. When H1N1, the swine flu came along, the first case was in April. We had a vaccine in November. Nobody said a word. There was not all this. It was too fast. It was April was the first case. They had a vaccine in November, and now ever since then, they change it every single year. It's incorporated with our flu vaccine, and so every single year they change that vaccine just so it can be more potent and more viable when it comes to the current flu that's out there. So they did the same thing. This is nothing new. This is something that they've been working on for over 30 years. This platform, when it comes to those messenger RNAs that Pfizer and Moderna, they've been working on that for over 30 years. And so as we know better, we do better. We should never have to wait 20 years for another vaccine, because the science is there now to where we can get a vaccine out fairly quickly. And I'm thankful and grateful for that you had all those hands in there that worked around the clock all over the world to get these vaccines out. And what's really great about it is that it was peer reviewed, checked by different folks from all over the world, and they all came down to the same results, that these were safe vaccines for all of us. And so when you think about, oh, they did this so quickly, there's going to be something else. There's going to be another virus or something else that comes out. They're going to be able to get it out another year as well, because the science is there now. We're able to do much better. And while we're here, they no longer put in those heavy metals like mercury. They no longer put in products like eggs, because folks are allergic to that. So they now use common food preservatives to preserve those vaccines. So they package that up, and that's what's injected into your arm, and that dissipates those preservatives, just like when you eat those hot dogs, just like when you eat all those other products, it dissipates. And then that little a bit of a remnant there. It comes in, does its job, lets your body replicate those antibodies, and then it dissipates out of the body. So there are no long-term residual effects because of what's in the vaccine. And they got it out quickly because they had so many hands in it to do it. I'm through.
Excellent, excellent, excellent. Thank you very much. That we brought together people who know, and not people who are guessing, people who know. I see Mayor Barbara Williams has been with us from the mayor of Fort Valley, so welcome her, and all of you. We thank all of you for being engaged with us. Just a word of prayer. We ask the God of us all, lead us from death to life, from falsehood to truth, from despair to hope, from fear to trust, to lead us from hate to love, from war to peace, and let peace and wellness fill our hearts, fill our city, fill our state, and fill our world. Until we meet again, God's peace be upon us and upon you. Amen. Thank you very much. And we look forward to the tuning in. And we're so proud of Morehouse School of Medicine, as well as CEAL and all of that. This is our people working to not only save us, but to save others as well. Thank you very much.
Thank you.
Thank you.
Have a wonderful evening, everybody.
Thank you.
Thank you.